Good afternoon. It's Wednesday and it's rainy and thundery, and I'm in Farmington, Illinois, hometown. So I'm Marylee Nunley. I'm the founder of Retreat and Refresh Stroke Camp that morphed into United Stroke Alliance, and we're all about the prevention, awareness, and recovery of stroke. So we're happy to have you with us this afternoon, and I'm very happy to have with me Dr. Jennifer Ohm, who is daughter-in-law to me. And I met her when she was still in vet school, before she and my son got married. And so I feel like I've kind of been with her in this whole journey of internship and the different jobs she's had. But just a little over a year ago, she opened a brand new clinic here in Farmington. She'd had a smaller clinic, but she got really busy. And so she's opened up a new clinic here just a little over a year ago and is actually going gangbusters. And I really appreciate her being with us today because she's getting ready to go on vacation, and this was her day off, and it was her day to get ready for vacation. So welcome, Jennifer.
Thank you. Happy to be here.
Thanks for saying that. The one thing she hates is being on camera. This girl hates being.
Most definitely.
So I have a few questions, and I have my sweet granddaughter Phoebe behind the camera. So if there's questions that come up, are you seeing their? Okay. If there's questions that come up that Jen can answer, she'll be glad to do so. But we've got a few things to talk about as far as pets are concerned. So we're going to first just have her give a little overview about cats versus dogs and different breeds, personalities, and such. So take it away.
All right. So I'm starting from the standpoint of if you don't already have an animal and you're looking to get an animal, how to go out and figure out what the best animal for you is. The most important thing to look at is first you need to look at yourself and your family and the environment and decide what kind of animal is going to be best for your environment. If you live on a farm and you have 80 acres for a dog to run, you're going to have a much different breed grouping than you would if you live in an apartment in Chicago with very little space to run. The other thing that's also out there is something like a cat. If you are less mobile and you are unable to take dogs out for walks and give them the exercise they need, cats are great company and can kind of contain themselves and take care of everything themselves. So that's a very nice aspect to have. But it's very important that if you have an active dog that they are given that exercise or they can develop bad habits. Dogs that are working dogs that don't get their exercise out, they tend to get bad habits, whether that's neurotic tendencies or separation anxiety, tearing things up. Those are all things that you don't want to deal with. So we need to look at the personality of you and the personality of the animal and make sure they mesh well together.
So I suppose a person would want to research different breeds, or if you're going to a shelter or someplace like that, the mix that they might be, and do a little research before you fall in love with something just because of the way it looks.
Most definitely. Some dogs, you may think that a Corgi, cute little short legs, is going to be a variety that would be great for you that doesn't need a lot of exercise, but they are very active animals, so they need that activity level. Mm-hmm. The thing about shelters is sometimes we don't know what they are. But the good thing is you can also get an older animal so you don't have to have the same puppyhood stage to fight through, because that's the hardest stage for animals and getting adapted. That being said, you also need to watch them for any tendencies they could have learned before they came to you. Some dogs have baggage that comes with them. Like I said, separation anxiety. They may have been in a place where they were not very well taken care of and they have separation anxiety from their history. So that's one thing to look at. But shelter dogs can be amazing. I have a good friend, Bonnie, who got a little Beagle Terrier mixed dog from the shelter, Bella, and Bella has been a great walking partner for her and an amazing friend. She's showed up just at the perfect time, and it's been amazing for her.
Very good, very good. So, yeah, I want to touch base on a little bit about typical pet care. Food and grooming and fleas and mites and critters and all that sort of thing. So you want to talk a little bit about just typical pet care, like basically, if you have an animal that's perfectly healthy, that never gets into an accident or really gets sick or diabetes or anything, kind of what would be typical, and then what are some things to watch for that might be chronic?
If you have, we'll start with puppy kitten. If you have a puppy kitten, they, just like our children when they're young, they will go multiple times through their childhood, that first 6 months to a year, to the doctor. So I recommend as soon as you get an animal, you go in, get set up with your veterinarian so they can give you a schedule and you know what's going on. That first year is going to also be the most expensive year because you'll have multiple visits, as well as a spay-neuter appointment for them towards the middle to end of that last year. So that's when you need to worry about spending the most money. Otherwise, every dog and cat need to go to the veterinarian at least once a year. As they get older, sometimes we'll get into the geriatric cases where they need to go every 6 months to follow up on everything. I'm always very adamant about every dog needs to be on a heartworm preventative. Heartworms are spread by mosquitoes, so absolutely every dog is susceptible to it, and prevention is as easy as one little treat once a month, or there are now injections out that can last for 6 to 12 months to prevent those heartworms. So heartworms can do lots of damage to their heart, and once they are infected, it's very expensive to treat, in the thousands of dollars.
Oh.
So well worth
Pay attention to thousands of dollars.
well worth about $100 a year at the maximum to treat them, to prevent it from happening.
Very good. Okay. All right. I don't have any pets. I would have a pet if I didn't have John. But he's in the hospital enough and all that, so I don't need to have someone else to have to take care of my pet.
And you have grandpets.
And that I was just going to say, I have all kinds of grandpets. I have several grandpets here, grandpets at my other son's house. So I'm around pets a lot, and I like animals. It's not that I don't like animals. It's just my situation isn't such. But the things I see about, like, a lot of times people post on Facebook, they found this dog, they found that dog along the road, and I know you get calls at night, all hours of the night. We found an animal and they think you should fix it for them here in your hometown. But having a chip or not having a chip, how does that work? What does it cost? And I know that this goes all across the country, so we're in the Midwest. And why should everyone have that done? Because I think everyone should. But.
I think every animal should have a microchip. A microchip, it's about the size of a piece of rice. And in dogs and cats, we implant it between their shoulder blades. We can do it when they're awake. It's just a simple needle. It's a little bit bigger needle than an injection needle, but about like if you're donating blood. So not a bad needle at all. Cost-wise, I would say anywhere from $30 to $50 for that. It will last the entire lifetime of the pet. And what happens is if somebody finds a pet and brings it to me, I have a little scanner that I run over their back, and it comes up with a 20-digit number, I think. And that 20-digit number can go all across the United States, and they've tried to kind of get at universal all across the world. And I call a certain number, and they can tell me who owns that pet, give me the information I need to get a hold of them. One of the biggest issues with those, and not being as great as they say, is you have to make sure that if you move, that you transfer your information.
Oh,
so
yeah.
And even when you first get it implanted, I always make a point to hand it to the owner and say, you have to finish this stuff, because once I implant it, you have to go online and put your name, your phone number, a good friend's name and phone number in case you're gone or have moved or whatever, so kind of an alternate thing. So, but every animal has to have a microchip in my thought process. There's lots of people that say, my cat never leaves the house. I don't understand why my cat needs to have a microchip. And we just, 2 years ago, I think, had a tornado go through a local town here. There was lots of animals where their houses were completely destroyed, and a lot of those animals were able to find their owners because they had a microchip. They were picked up by a Good Samaritan, mile, 2 miles down the road, taken to the shelter. They were able to scan it, find that owner, and get them back to their people. So that was really nice that animals were able to be reunited when people had lost everything else.
Absolutely. There's a lot of talk about pet insurance, and I don't know much about pet insurance, and I know you've had some of your clients that have had the pet insurance or not had pet insurance. And To the best of your knowledge, what you know about that. You want to talk about that just a little bit?
Yeah, we don't deal a lot with pet insurance. Pet insurance has not evolved to the level in human healthcare, nor do I want it to, where the insurance company is responsible for paying us. So the way pet insurance works is you get your policy, you pay your bills to the veterinarian, and then when you're done, you send all that paperwork off to get reimbursed. So, which works out well for the veterinarian because we know, at least in Illinois, a lot of the states aren't paying their providers what they need to. So we don't want that to happen in veterinary medicine. Every policy is a little different as opposed to what it covers, whether it covers basic yearly vaccines or if it just covers issues, broken bones, extraordinary measures like that. Policies are anywhere from $10 to $100 a month, the average being about 30 to 50. Depends on the age, depends on what all is covered, and also depends on how much your deductible is. So you can make your deductible anywhere from $50 to $500. So sometimes it is wonderful. It's truly insurance. Sometimes you will never use it, and sometimes it's absolutely wonderful. I've had an owner that used it on her dog so many times that it paid for itself in 20-fold. The dog had 2 knee surgeries. The dog had bladder stones removed. She ended up being diabetic. So all through that lifetime, she was able to use it, and it was well worth it for her.
Okay. And it's like our own insurance. We can't predict.
Right.
We can't predict.
Right. You never know the future.
Yeah, we don't. We don't. We're in the summertime here in the Midwest, and I know some of our folks are in Texas and Arizona and some warmer climates. And then, the folks in Minnesota have a different set of seasons. But as far as seasonal considerations, I guess both for breeds that you might have and own and for what you need to be most careful of in the summer and then maybe again in the winter when it gets really cold.
Okay. We'll start with breeds first.
Okay.
Again, I think this goes back to where we started. You have to look at what your environment is for the animal. I have a hard time with looking at Arctic breeds that live in Florida and Arizona where it's really warm. They just have a harder time being comfortable in those areas. So that's something you definitely need to look at. If you love that breed and love to go running, taking a husky out in Florida to run 3 miles is going to be very stressful on that body. But then again, if you live in northern Minnesota, you don't want to get a Whippet or a Chihuahua and have that dog outside for long periods of time. So those are a couple things to think about. Basic Illinois, basically Midwest considerations to think about is in the summertime here lately it's been 90 degrees and humid outside. Everybody needs to make sure their dogs are not overheating, give them plenty of water, and bring them inside. So even if they have water, even if they have shade, they can very easily get overheated outside. So it's good to bring them in, and we wouldn't want to sit out there all day long every day, so we don't need to have our animals do that either. So a couple other poison control sort of things to think about in the summer times, antifreeze if your car's overheating. That's kind of a summer winter both thing, but antifreeze is very important if you're overheated in your car and you spill antifreeze. That can something that's very toxic. Yes. Yep. So, and then in the wintertime, even just the rock salt you put outside, that can be toxic to dogs. It can injure their paws if it gets caught on there, so wipe their feet off before they come in. Try to stay out of those areas. So
I didn't know that.
Yes.
Well, I don't have any dogs. I guess we don't have to know that. Have any questions popped up, Phoebe? No questions.
No questions.
Okay.
I'm answering them all.
You're answering it all. The last thing I had here is to ask you specifically, and then if you have any afterthoughts. We have a question.
Georgia wants to know, how about plants?
Ooh, good question, Georgia.
Good question, Georgia. There are a multitude of plants. Everyone is a little different. The first one that pops to my mind is for cats. Any kind of a lily plant for a cat is very toxic and causes kidney failure. So whenever my florist in town knows not to ever send me flowers with lilies in them because I have cats around. If a cat were to come up and chew on a lily leaf, they could get kidney failure very easily. It's a little hard. I mean, I don't know any that jump out right at me. I did just have a toxicity that it took us a while to figure out. We had a little dog who came in with an elevated heart rate and an elevated body temperature. We treated it symptomatically, and the dog was okay. And then the owner went out to her yard and started looking at the different plants the dog was eating, and it ended up being a hydrangea plant. So that was one of the symptoms of a hydrangea toxicity. I had never seen it before, and it was kind of a new one to me, but it definitely popped up. The other poinsettias have been known to be toxic in dogs, but it's not as bad as they say. A lot of it is more just their mouth gets irritated from chewing on something, from chewing on that plant, as well as there's a few other plants in the oxalate category that will do the same thing. I can't think of any. You kind of stumped me a little bit, Georgia. I can't think of too many more off the top of my head without looking
up.
Yeah.
Research. I guess for those that don't have a pet, or maybe those that do have a pet, the consideration of cost of ownership, and I think I've seen this more with young people that fall in love with a pet, and I want a dog and I want another dog, and then they can't afford it, and it's a problem, and they want the vet to do it for free because don't you want to help my dog for free? Have you ever heard that?
We love animals, but we cannot afford not to eat ourselves. So we have lots of bills to pay and staff to pay. So even though we love animals, we will donate to shelters and that sort of thing. But doing free care is very difficult.
Well, you have to be careful.
Yes.
Yeah.
Yes.
So anyway, cost of ownership, if you had to ballpark it.
So I'm gonna say for a dog, I would expect to pay on average $400 to $500 a year. That's going to include annual vaccines, a heartworm check, as well as heartworm preventative and flea and tick medicine. So cats are going to be a little less expensive. You don't have heartworm preventative in those cats typically. So just a couple vaccines. So basically for vet care for a cat, I'd probably say $200-ish for the year. And that is basic care. That's nothing emergency wise. So emergency wise, if the insurance is a great answer to that. If you don't have the funds to have that emergency, that can be your emergency fund. The other thing is start a savings account just for that purpose. I even have a client who comes in and pays $20 on her non-existent bill at the clinic every month, so she has a credit on her account all the time.
Okay.
And so when she has money, she puts it there because she wants to make sure her animals are always taken care of. And it makes it very easy for us because we know that she's this is her money's set aside, and that's what she's going to do. She is not well off, but she is able to do that, knowing that will make her feel better.
Well, and the pet's important to her.
Right, pet's very important to her. Yes.
I didn't know this until maybe 10 years ago or so, that cats and dogs both can be diabetic. Is there a reason that they become diabetic? Is that just random, like it is in humans? What do you know about that?
There is a genetic component to it. There's a couple breeds that are more likely. The other reasons are truly, the first reason is obesity, especially in cats. When we have obese cats, we try to start warning people right from the start. If you don't get this under control, we're looking at diabetic later in life. When cats and dogs are diabetic, the injections are the only thing to do for them. So there is no pill, there's nothing else that helps them besides the injection. So a lot of times when we start talking injections and what treatment looks like, owners start thinking twice about it.
Yeah.
So
don't give that pet
yes
candy and sugar and things that they're so cute when they get to eat it. They're so cute.
I mean, honestly, pet obesity is a huge, no pun intended, issue with people. They basically feed their animals to death. They overfeed them and cause them to have other issues. So it makes them overall unhealthy. They are more likely to have those issues. So one of the things I always talk about is if you ate, a potato chip, say average 180-pound person, you fed your 10-pound dog that same potato chip. That's like feeding that dog 18 potato chips. Or you eating 18 potato chips. If you look at the calories and the body mass going on, it makes a big difference. One McDonald's hamburger for your dog, and 10 McDonald's hamburgers for you.
Ooh, that's a good analogy.
It's a good way to balance it, because people don't always think that it's only one potato chip. Yeah, but not just one potato chip.
Yeah, absolutely. Anything else that's popped into your head that we've overlooked?
Any more questions, Phoebe?
Any other? No other?
Oh, Georgia said sorry. That she stumped you.
I got a
That's
couple
okay.
of them.
That's okay. We're okay with that. So. Okay. Well, thank you very much. No need to be nervous.